So there's a variety of ways to replace a hip. And it's a common question I have in clinic from patients is, I've heard about anterior hip, I've heard about posterior hip, I've heard about front, back, and it's a question that many patients have. So the difference between the two is simply how do you get to the hip to replace the bones and the cartilage that are worn out. So an anterior hip is a hip replacement that's performed from the front, from a front incision. And a posterior hip is a hip replacement that's performed from a posterior or back incision. Both procedures end up placing implants inside the bone, and that includes a cup, a plastic liner, and a stem down the thigh bone with a ball. So rather than being bone on bone from hip arthritis, now you are metal or ceramic on plastic. So the main difference between the two, as I alluded to earlier, was how do you get to the hip? There's a posterior hip and an anterior hip. The one thing I talk to patients about is that we can perform both options here at Reedsburg Area Medical Center, but what it really boils down to is what's the best approach for you as a patient. And that's something that we would discuss in clinic. It depends a lot on the extent of the arthritis, if there's any deformity, if there's pre-existing surgery or any retained hardware in the hip. And sometimes the decision is easy to make based on those factors, but oftentimes I discuss the pros and cons with the patient and we make a decision together.